There's a new test in the works, and this one is cutting down wait time and is painless. Wait News Health and Medical reporter Veronica Marshall shows us what the University of Miami is working on that could revolutionize COVID testing.
As COVID cases climb,
we could end up seeing this thing continue to skyrocket for the next 2 months. I honestly wouldn't be surprised if we start to detect 200,000 cases a day.
But Harvard's Dr. Michael Minna says there's a way to stop the virus's winter wave, and it's not a vaccine.
Flood them with frequent testing so that as many people as possible at any given time know their status and can isolate and quarantine.
But current COVID tests are either too slow, invasive, or expensive for frequent testing. That's where the University of Miami's new pilot study comes in.
You blow, and the salivary particles that are in your saliva are captured in the breath test. And then we are able to test it for the presence of COVID.
Dr. Aaron Kobetz, who leads the clinical study, says all it takes is 3 breaths. Less than 5 minutes later, you'll know if you have COVID or not. Kobetz's team will test 1,000 students and staff and compare the results to COVID PCR tests to check their accuracy. If the breathalyzer test is effective, Kobetz says it could be used before people go into stadiums and arenas or classrooms.
One, it's pretty low cost, so it would allow for large numbers of people to be tested on a frequent basis. And 2, it's pretty simple to use.
And 3, it might help create a flood of tests to wash away the winter wave. Veronica Marshall, Wink News Now.
Now, the data collected by the University of Miami will then be sent to Tera Group, the same company who created the breathalyzer, so it can apply for an early use authorization.